All right, today we're going to cover the cardiovascular system and the peripheral vascular system. My name's Sarah Clark, this is Kylie. She has agreed to be our model today. In a real clinical situation, if you were doing a full cardiovascular exam, you would have the patient in a gown with their chest exposed so you could see all the arteries and intercostal spaces, but for the sake of modesty and for Kylie's sake, we're going to keep her clothed and just do the assessment externally. So the very first thing you're going to do is inspect. You always want to follow the same order when you're doing an assessment. You inspect and then auscultate and then palpate and percuss. With the cardiovascular system, we don't really percuss much anymore. They used to percuss the borders of the heart, but we don't really do that because muscle tissue and breast tissue get in the way, so it's not as accurate. So we're going to start with inspecting. The first thing we're going to do, Kylie, I'm going to have you turn your head to the left. We're going to, good. We're going to assess the jugular venous pulse. You can see the external jugular vein right there. You can't always see the internal jugular vein, but you can see it pulsing. Often it's low down, especially in a healthy person without cardiovascular disease. You can see it pulsing right here in Kylie down, kind of close to that sternal notch. So I can feel that pulsating right there. So what you want to do to measure the jugular venous pulse is you take something with a straight edge and hold it right to where you can, the lowest point where you see it pulsing, sorry, the highest point where you see it pulsing, and then you measure the distance between the pulsing and the sternal notch. So for Kylie, that is about 2 centimeters. And anything less than 3 centimeters is considered normal, so that's a normal finding. So you can go ahead and look straight again, thank you. The rest, when you're inspecting, you want to make sure you're just going to inspect in general. I'm going to pull this a little tighter here if you're okay with that. Over the heart area and see if you see any heaving or any pulsating, anything like that, any lifts from the cardiac area, which I don't see. It all looks very normal. So the next thing I'm going to do is I'm just going to palpate your carotid pulses. You never want to do this at the same, or your carotid arteries. You never want to do it at the same time or it can cut off blood flow to the brain. And you don't want to do it up high where the carotid sinus is, or it can cause a vagal response and actually drop their pulse. So I'm just going to do first on this left side here. I'm going to feel down here for the carotid artery. And you're feeling for the amplitude and the rate of the pulse. Feels very normal. You should feel like an upward pull or a motion. Sometimes you have to displace the sternocleidomastoid a little bit to be able to feel that pulse. And then you want to repeat it on this other side. And same thing, all feels very normal. Okay, like I said, it should be a brisk upstroke. That upstroke happens between the S1 and S2 sounds of the heart. So if you're having a hard time, if you're listening to the heart rate and you're having a hard time differentiating S1 and S2, you can auscultate and feel the carotid pulse at the same time, and that should help you differentiate your S1 and S2 sounds. Next, I'm going to auscultate the carotid artery and listen for a bruit. You would do this if while you were palpating you felt any thrills. A thrill is kind of like if you felt a purring with your fingers. And a bruit when you're listening kind of sounds like turbulence, almost like a whooshing noise. So you do this with the bell. You can do it with both sides. We're going to do it first with the bell of the stethoscope. So turn this around. I'm just going to listen here on the right side. And on the left. I'm going to do the same thing with the diaphragm, and then again on the left. Okay, if you hear a noise and you're concerned it might be a bruit, you want to rule out that it's not just like an aortic murmur that you're hearing higher up. So in order to do that, just when you're listening to the heart sounds later on, just be very cautious and see if you hear any murmurs anywhere else. If you do, like if you hear it when you're listening over the aorta, then you would know that it's an aortic murmur and not a bruit on the carotid artery. The next thing I'm going to do is just listen to the heart rate in general. I'm just going to put my diaphragm just right over the general area of the heart. I just want to get just kind of a pulse rate and listen to the rhythm here. See if I can hear both S1 and S2 sounds. Make sure there aren't any murmurs. You should hear kind of like a lub-dub noise. The S1 sound is made when the mitral and the tricuspid valves are closing, and then S2 is when the aortic and pulmonic valves close. Okay, So then after I've listened for a general heart rate, it's regular, you don't have any murmurs that I've noted, so everything sounds good so far. You want to listen in 4 different places. So the first thing, well, first before I listen, I'm going to palpate the 4 different places. So you're going to go to the second intercostal space on the right side, and then palpate there, feel for any irregularities, and then you go across to the left side, and then you kind of work your way down. You go to the 3rd intercostal space, the 4th intercostal space, and then the 5th intercostal space, all normal. And then if you want to feel the apex of the heart, you go where the 5th intercostal space lines up with the clavicular. So right there, midline, right about there, you can palpate and feel the apical pulse. And I don't feel anything out of the ordinary there. So then I'm going to go ahead and listen to those same spots, both with the diaphragm and with the bell. So first on this right side with the bell, and then to the left, 2nd, 3rd, 4th, 5th, and then the mid. And then I'm going to do the same thing with the diaphragm. Okay, and I don't hear any split S1 or S2 sounds. I don't hear any murmurs, anything like that. It all sounds very normal. So you're doing good so far. If you're concerned about anything you're hearing, you can change the position that you're auscultating in. For some patients, if you're worried about like aortic insufficiencies, if you're worried about aortic insufficiencies, you can have them sit up, and you hear it more when they're sitting up. So Kylie, I'm gonna have you didn't have anything abnormal, but just so we can show all the positions, you would just repeat the same thing. You can palpate when they're sitting in this position, but mostly we're gonna just listen. Same thing, start on the right side, and go to the left, and then work your way down along all those intercostal spaces. And again, everything sounds really normal, so go ahead and lay back, and then I'm gonna have you turn on to your left side. And then you're going to do the same thing here. I'm just going to reach over you this way. Up. And working around. Okay, everything sounds really good, so you can go ahead and go back on your back. All right. So that is about everything for the cardiovascular system, the central part. Next, we're going to do the peripheral system. So some things we're going to inspect are your arms and legs. Just want you to relax them here. We're inspecting the color of your arms and your legs, the temperature, make sure they all feel warm. That's a sign that they're getting enough blood flow. All feel warm. I'm going to go ahead and look at your fingers here and check your capillary refill. To check a capillary refill, you press down and compress for a couple seconds and then let go, and you should first get blanching, that's white, and then the blood flow should return and it's pink, and then you just count 1 Mississippi to how many seconds it takes for the blood flow to return. Took about 1.5. So your capillary refill is normal if it's less than 3. I'm going to peek at this left hand, do the same thing, it's good, and then do the same thing on your feet and on both feet. Alright, and that looks good. The other thing you're looking for on the hands is clubbing. If you had clubbing, you would see kind of a curvature upward here on the fingernail. It can be a sign of decreased oxygenation to the extremities, and yours all look very normal. Another good sign of good cardiovascular perfusion is hair distribution on your arms and your feet. Like if your patient has hair on their toes, it's actually a good sign because it shows that the blood flow is getting all the way to the extremities. If they don't have hair, if their skin is very shiny, you might be concerned that the blood flow is not as great like in a diabetic patient. When you're looking at their legs, let's see, I need to turn my camera here so I can see your legs. You're doing great, Kylie. Thank you. You're natural. I'll raise your butt up. When I said aortic insufficiency, I was like trying to read the word, and I couldn't. I was like, what does that word say? Like, I could not read it at all. Okay, you do it ginormous. They do. Okay, so when you're looking at the legs, we talked about hair distribution. You also just want to make sure you're looking at their skin for any ulcers or lesions or any thrombophlebitis. Kylie does not have any of that. It all looks very even colored, even temperature. Looks really good. You can also check for edema, especially around the ankles and the feet. And you do that by just pressing into the bone, the ankle bone, with your fingers. And if you had edema or pitting edema, it would kind of leave a divot where your finger had just been, but Kylie does not have any edema, so that all looks really normal. And then when you're palpating, you want to be able to, we talked about palpating the capillary refill on all the extremities. Next, you just want to check all of the pulses. If you ever are checking a pulse and you can't palpate it, you could check it with a Doppler to get the same information. So first, I'm going to palpate just the aortic pulse, and that's in the abdomen here. And if you go just above the umbilicus, you can palpate deep and feel the pulse there. And then you would also palpate the femoral artery, which sits right in the inguinal canal right there. So I'm going to palpate those as well. And feel both of those. They should be bilateral and strong and equal. You can also listen for a bruit on the femoral artery, so I'm going to do that as well while we're here. Okay. And then other pulses you want to feel, you can check the radial pulse, which is just near the proximal side of the thumb here. You're going to check it on both sides. And then the brachial pulse you'll feel in the antecubital fossa, right on the inside of the elbow there. And then the dorsal pedalis pulse is on the anterior part of the foot. And then the posterior tibialis is on the medial malleolus right behind that. You can feel it on both sides. And those should all be the same bilaterally. Check them on both sides always. And then the last pulse we're going to talk about is the popliteal pulse. It's behind the knee, so in order to do this, you just have them bend your knee a little bit, perfect. And then you kind of cup your hands behind the knee and feel for a pulse. Perfect. All right, go ahead and relax that leg. Okay, another test you can do to check circulation is called the Allen's test. You would do this if you had put in like an art line and were worried about blood flow, if you had hand surgery, or if you just had any other reason to be concerned about the blood flow to the hand. So what you do, I'm going to have you make a fist, and then I'm occluding both the radial and the ulnar arteries here, and then I'm going to let go of the ulnar artery and have you open your hand, and I'll let go of that artery, and her hand should return to pink, meaning the ulnar artery is giving blood flow to the hand. And then make a fist again. I'll occlude both of them, open your fist, and then I'll unocclude the radial artery, and again her hand should turn pink, meaning that blood flow is returning back. So that kind of tests the blood flow from each artery individually. I need just to review this one again. Oh, I think I only have one more thing left. Sweet. I know I have this memorized, but I'm pushing it over here anyway. We just do it like nothing ever happened. Okay, the last thing we're going to talk about is the ankle brachial index, and that checks for peripheral sufficiency. Since we don't have a Doppler, I'm just going to explain to you how this test would work. Essentially, this test is useful in determining the any peripheral vascular disease when the lower extremities are not getting sufficient blood flow as the upper extremities, or vice versa. It's used to compare the upper and lower extremity systolic blood pressures. So what you would do is I would take a blood pressure cuff, a sphygmomanometer, and I'd put it on Kylie's right arm, and then I would pump up the cuff until I could no longer palpate the pulse, either with my hand manually or until I couldn't hear it with the Doppler. And then after I couldn't hear it, just like a normal blood pressure, I'd slowly release the pressure. And then as soon as you start to either palpate or hear on the Doppler the pulse again, that's your systolic pressure for that artery. And then you would repeat it on the left arm. And then the higher of the two readings is the one you would go with. And then you would do the same thing on the lower extremity. You would put the cuff on, measure the systolic pressure of either the dorsalis pedis artery or the posterior tibialis artery, and then you would repeat it on the right leg and the left leg, and then whichever is higher is the one you would go with. And then that way you can use those numbers to calculate the ankle brachial index, and that kind of just helps you understand the peripheral vascular disease and how severe it is or not. And that concludes our cardiovascular assessment. Thanks, Kylie. And did I tell you I feel stupid when I do these things? Or did I tell you I feel stupid when I do these things?
That was so fun.
You did great. But really, on all serious note, I'm very grateful that you let me do this to you.
You sound so smart. My feet look so big in this
They
angle.
do look very odd.